Hi guys, welcome back to my channel. Today we're going to talk about how to ace your first nursing interview. So we're going to go over some typical questions and how to answer them so that you are guaranteed to get your first nursing job. So the first question I'm going to talk about is, tell me about yourself. So this question I do not like because it is so broad, it is so vague, and a lot of people stumble on this question because they don't know where to start. So the way that I approach a question that is so broad and so vague is I genuinely am honest. So I usually start by saying, you know what, I just graduated from nursing school and I'm looking to further refine the skills that I've developed. And I talk about my clinical placements, just a brief overview of my preceptorship or consolidation and any volunteer experience that I've had in the past and how excited I am to join the nursing field now. This shows a brief history of all your clinical experiences and how you develop those skills and how you're going to use them in this future position. The most common question that most people get in their nursing interviews is, what are your strengths? Again, this is a very broad question and there are many ways to answer it, but the most important thing to remember is to answer your questions with clinical examples. That way you're showing that you have the strength and that you've demonstrated that strength in a clinical setting. So the example that I often use is, I think that I have great communication skills. Now you can say whatever you want as long as you can back it up with a clinical example. So nursing has so many clinical skills. You can talk about critical thinking, you can talk about being a team player, but I like to go with communication. And the way that I explain why communication is my strength is because I talk about a clinical example of how I use communication in a hospital setting. The example that I use is that I needed to one time report my findings on a patient to a doctor, so I use the SBAR method in order to communicate these results. The SBAR method, if you're not familiar, is situation, background, assessment, and recommendation. So I explain a short clinical example and I say that I use this communication tool. This way I have talked about how I use this strength in a clinical example, and I am explaining how I use a tool I learned in nursing school to communicate those results. And communication is really important because you want to be able to report your findings to other healthcare members to show that you can talk to other people on your team and collaborate with them. So I often go with that sort of a strength. Now, to counteract that, another question you often get is, what is your weakness? So my weakness, or my go-to weakness, is always the fact that I'm a new graduate nurse, and being a new grad means that you lack clinical experience that another candidate may have. They may have 2, 3, 4 years of experience where you're going with really no work experience as a nurse, but don't let that stop you. I always say that, you know what, I'm a new graduate nurse because it's honest and upfront. Being a new grad nurse, you lack experience. But how do I counteract that? The way I do it is I always talk about my consolidation and my clinical experiences in nursing school, because I'm talking about how I pushed myself in those clinical placements. So for example, I'll talk about if I'm applying to an OB position, I'm going to talk about my pre-grad, which was in labor and delivery, and how, you know, I was able to do Foley catheters and feel heart monitoring and collaborate with a team of nurses and doctors and anesthesiologists, etc., etc. And so I have learned all those skills. And so that puts me over another candidate because I'm talking about how many skills I learned during my consolidation and how I pushed myself and motivated myself in those previous placements. I will also talk about any volunteer experience or internships that also added to just clinical placements, and I think that definitely puts you over the edge if you do have those kinds of experiences. So another common question that I always get is, give an example of a time that you worked on an interprofessional team. So what that means is, how do you work with other healthcare professionals, and have you done it in the past? Again, you want to give a specific example of how you collaborated with other healthcare professionals on the team. So if you're in med surg, for example, it's not just nurses and doctors. There are physiotherapists, occupational therapists, dietitians, speech language pathologists, social work, so many different specialties that you're working with in order to provide the best possible care for your patient. So one example that I like to use, again, specifically focusing on labor and delivery, is my patient wanted an epidural and spoke no English. So I collaborated with a translator and an anesthesiologist that I could give my patient the most information that they needed in order to make a decision as to whether or not they wanted that epidural, and it allows for them to receive that informed consent. So that is really important because you want to talk about that. You can collaborate with a team, you can talk to other healthcare professionals, and that you are doing that because you want to provide the best possible care for your patient. Another question that I always seem to get is, describe a time when you had a conflict with a colleague or another member on your team or a doctor or a patient, and how did you resolve that conflict? So conflict is a big thing that happens in nursing. So you want to make sure you answer this question very carefully. You definitely do not want to say, you know, I got into an argument with a patient or I got an argument with a colleague and, you know, we could not come up with a reasonable compromise and there was yelling involved. That is something you want to avoid. You always want to talk about how you collaborated with the person that you may have differential views with, that you came to a consensus, that you came to a compromise, and that you were able to come up with the best possible solution for your patient. Again, giving a specific example. And again, you never want to talk about how, you know, you yelled at someone. You always want to say you approached it in a calm manner in order to put both ideas together, or listen to whoever it was that you were having a conflict with, because you always want to make sure you're listening and you're addressing any concerns or questions or opinions that other people have, because nursing, again, is a team-focused job. Also gotten the question, how would your friends describe you? So that's kind of an interesting question, because this interviewer definitely wanted to know how I was as a person, and not so much how I was as a nurse in terms of like my hands-on skills or my critical thinking skills. They wanted to know who I was. And so you don't want to say for this type of question, oh yeah, my friends would describe me as a critical thinker, because they're more so looking for, are you passionate about nursing? Are you motivated? Are you driven? Are you compassionate? Are you empathetic? Those are the kinds of qualities that they also look for in nursing. It's not always just about medicine and thinking skills and hands-on skills. Like, oh yeah, my friends would say that I'm able to put in an IV. It's about other characteristics as well. They want to know that you're a good fit for their team. Now, there are two things that you want to research before you come into a position or before you come into a job interview. And those two things include research on the hospital or the clinic that you're applying for, as well as the actual unit and the skills required. So for example, let's talk about the hospital research. So the hospital that I was applying for was a teaching hospital, and it really focused on best practice guidelines. So because I knew that, I definitely wanted to include that in my answer. So if they ask, why do you want to work at this hospital versus hospital B or C, you want to make sure you know what that hospital is known for, whether it's cancer research, whether it's a teaching hospital like mine. And you want to talk about how not only is that amazing that the hospital has it, but maybe you have something to offer for that. So for example, the job that I wanted to apply for was at a hospital that was a teaching hospital, and I really see myself in the future as a preceptor or a nursing instructor. And I talked about how maybe in a few years I still want to continue nursing, but I also would love to teach my fellow nurses you know, about the unit, about these skills, and that's what I'm interested in. And I've always appreciated teaching and having a good preceptor in the past, so why not be that for somebody else? And I find that I get a really good response when I talk about that. The second thing you want to do, again, is research the unit that you're applying for. The job that I was applying for was an OB position, and so I needed to know certain assessment pieces or skills that are required for an OB nurse. Now, I'm not saying you need to know everything. Like, for example, if you're going to med surg, maybe you're nervous because you've never done a blood transfusion before and you're nervous they're going to ask you about that, and they're not going to ask you about that. But they are going to ask if you have some sort of a general idea of certain tasks or certain skills that would be required for that position. So for OB, they asked me, how do you know a baby's feeding well? How do you know if a newborn is in respiratory distress? What would you do for a typical newborn assessment? So these sorts of questions, again, they're not very specific, but they want to know if you have a general idea of how to do a head-to-toe newborn assessment. So I would know the certain skills and assessment pieces to some general idea, just in case before you are applying to that position. And a lot of it will come back to you from nursing school or from your clinical experiences. The last thing I want to talk about is questions. Always make sure that you have 3 or 4 questions prepared to ask the interviewer at the end of an interview. This shows that you're interested in that position. And so you want to have a few questions prepared in case they've already answered one of your questions. So for example, I like to always ask, what's the orientation process like? What would my schedule be like? How are the workers on the team? I always want to ask those kinds of questions because I'm genuinely interested in what would my orientation be? Is it going to be 1 shift that I shadow a nurse, or is it going to be 12 shifts that I'm shadowing a nurse? It's really important to wear something that you feel confident in. And if you don't feel confident, it won't come across in your interview. So don't wear something totally uncomfortable. Wear something professional, but make sure you're comfortable. Make sure you can move a little bit. You don't want to be kind of tight, and your body language is really, really important. Which brings me to my next point. A lot of the times it is more than one person interviewing you. So you want to make sure that you're making eye contact with many of the people that are interviewing you. Also, a lot of the times they're writing stuff down. Don't be intimidated by this. I actually like this, that they're always writing stuff down because they're putting their head down, and now I don't have to constantly make eye contact with every person. It's okay to break eye contact, you know, stare at the person interviewing you, but I actually like that there's multiple people around so that I'm not just focusing on one set of eyes, I'm looking at other people's eyes as well. Thank you guys so much for watching. If you have any other questions, make sure you ask them down below. I'd be happy to answer them. And if you have any other video nursing related recommendations or non-nursing related recommendations, please ask me down below. Thank you so much. Bye guys.